Hello everyone, today we're going to remove some stitches and a drain after surgery, and we're going to clean, sanitize, and put this aloe vera to start the healing process. First, we're going to start by sterilizing our instruments. We have some tweezers and some little scissors here. I'm going to burn them so that they can get hot enough to the degree where they kill the bacteria and germs. And then I'm also going to take an extra step and also boil them for about 10 minutes or so. To disinfect, of course. So I let it sit for 10 minutes. And we are almost right about done. And of course, they are hot, so I wouldn't get them with my hand. So we're going to use this to get them. I wait for them to cool down for about 10 minutes. And then I'm going to spray them with the antiseptic spray. Extra measurement to sterilize and clean. And they should be just about ready to use. Now we're going to need some gauze, some gloves, some surgical tape, our antiseptic spray, and our rifocina, which is an antibiotic spray to heal, and our instruments, and our aloe vera. This is my nurse, and she's going to start by spraying the antiseptic spray to prevent infections. She's going to start pat drying with the gauze. As you can see here, I have a lot of cuts. They're not scarred yet, but since they did do a donut lift on me, they lifted me with a very good, strong surgical tape. And after removing it, my skin came off with it, but nothing to be scared of. Sometimes it happens. And aloe vera is actually really good to remove that. So in order to cut the stitches, you always want to pull the knot first. You never want to cut with the knot there. You have to pull where the knot is, and snip right under the knot. That's how you remove the stitches. Sometimes if they're twisted or if they went over and over and over them again, which in this case the doctors did, they did it like 3 times, 3 little loops, she might have to pull and do a couple snippets. But yeah, you always want to pull where the knot is and then snip under it, and usually the stitch will just dissolve on its own. So here she is pulling them out. And again, this is done by a medical assistant that is in school to become a doctor. We are not saying that this is something you should do at home, but this is home stitches and drain removal, and this is the process on how to do it. We recommend that you always seek medical treatment and have a medical professional do this for you. So she is now slowly removing them. These stitches were put on pretty good. So there you go. She got the most of it out. And she is going to make sure everything is out. The next step would be to disinfect the area. Spray around there. And then pat dry again with some clean, sterile gauze. And then she's slowly going to start pulling the drain. You want to make sure not to yank it all out. Sometimes it'll pull back when you're pulling. So you kind of just got to take a little stop, a little pause, and let it do its thing. And then just try pulling down slowly again. And just keep pulling slowly. You don't want to yank this. Want to make sure you're pulling it out very slowly. Tell the patient to take a deep breath and let them know when you're pulling, and then tell them to breathe again. And then maybe take another deep breath while you're pulling, because it can be a little painful until you take everything out. This was a very, very long drain. It was wrapped all around my entire breast. Next, you're going to apply some pressure. This video was fast forwarded, but she did apply pressure for about 2 minutes, and she was pushing really tight so that it wouldn't gush out. After that, she's going to patch it with some gauze and some surgical tape. Again, I have, these things from these scrapes from the tape. It took some out of my skin, and then the drain caused those little things. But I will make a video later, and you will see that the aloe vera will almost heal my skin, and you will not see none of this. I love aloe vera. I've done it. I've used it for all my surgeries. It will literally grow my skin, and this will be like it was never there. I love aloe vera. Savila is a very good healing plant. So now she's just patting down. Next, she's gonna put the Rifocina spray again. The surgeons love this. They use it throughout surgery, and it's for healing, and it's like antibiotic, and it just cleanses you out, and it helps you heal as well. She's gonna spray it. These are not open wounds. They just look raw, but she's gonna spray it anyways, just because it has antibiotic. Then you want to kind of let it dry. You can use a blow dryer on cool or a paper or something, and just put some air on it. Okay, so now this is what it looks like. Pretty girls, I know. She's going to patch it down. She's creating a little band-aid type. And the reason she didn't make a big one is because she wants to leave my other wounds open, because now we are going to apply our aloe vera. Again, this is not any medical advice. This is just something I prefer because aloe vera heals me. And I will do a video later after using aloe vera when all this heals, and you will see that none of that will be there. None of it. It will be gone. I won't even scar. I am also going to rub it off video on my entire breast except for the scar area. But all around my breast, just because they're really swollen. And the Savila is going to make it feel really good. And I'm doing this, putting the aloe on them about 3 times a day. And allow it to air dry. This is my nurse, aka daughter. And this is the drain that she removed. Thank you for watching.